When I asked women what's the #1 killer of women in the United States, the vast majority say breast cancer. And it never occurs to them that heart disease is actually the #1 killer of women in the US. A woman is more than 10 times as likely to die from a heart attack as they are to die from breast cancer. Over 500,000 women will die of heart disease this year. Women present differently than men with heart disease. Men tend to have more of a typical chest pain, chest pressure, radiating down the arm, radiating up into the neck. Women, however, often present with a pain that's in the stomach, in the epigastric area, up underneath the breastbone. A lot of times it doesn't radiate. It's mistaken often for gallbladder disease, which is often also common in women. The same as heart disease forms differently in women, we need to use a different strategy in detecting heart disease in women. Traditional stress testing that is more accurate in men is not particularly accurate in women. We need to add something extra. So the addition of echocardiography to the stress test, or what we call a stress echo, is much more accurate in that we get some images of the heart and how well the heart contracts, and images of the valves in the heart, along with the electrocardiogram or electrical portion of the stress test. We do stress echocardiography on all women that we evaluate for heart disease here because the test is more sensitive and more specific to diagnosing heart disease in women. With intervention, we want to intervene in the risk factors for women when they're much younger, even in their 20s and 30s, to get their cholesterol down to normal, normalize blood pressure, stop smoking. Of course, you can't do anything about your family history, but being aware of that as well. Eating a proper diet, exercise program, weight reduction, etc.